full order, complete mayhem. Ah! Magnum Magnesium has lost his authority. Every organ's going buck wild in the saloon of your body. Yeah! Hypo meaning low, manganese meaning magnesium, and emia in the blood. So magnesium less than 1.3 in the blood. Magnesium's main function in the body is to maintain law and order in the muscles, basically acting like a sheriff, by calming them down and keeping the peace, mainly in the uterus and the heart, to be honest. Magnesium is required for calcium and vitamin D absorption. It helps keep healthy immune systems, strong bones, and stabilizing blood glucose levels. Now, main causes that dump magnesium out of the body and into the potty. We use the acronym CRAY because everything in the body is going crazy, like cray-cray. C stands for consumption of alcohol in excess, which inhibits magnesium absorption in the GI tract. R is for really large fluid loss, for example, like NG suctioning or vomiting, even diarrhea or diuretics.
Because where fluids flow, electrolytes go!
A is for antibiotics like aminoglycosides, and Y is for young mothers, which are usually high risk for malnutrition because they're young and not really responsible, especially with their diet. And it can lead to deficiencies in folic acid, iron, as well as magnesium. So what's going on in hypomagnesemia? Well, low magnesium, right? And since Magnum Magnesium is Mr. Law and Order, keeping the peace in every muscle of your body, well, everything's going out of control and basically buck wild. Yeah! So the heart's going buck wild, so vital signs, you'll have an increased heart rate known as tachycardia. You'll have cardiac dysrhythmias like prolonged PR and QT intervals. The ST segment will be depressed, and you'll have T-way inversions. Now, this is just fancy words for ventricles repolarizing and refilling too quickly. Profound signs would be a tornado in the heart called torsades de pointes, which is a huge NCLEX tip. Very severe low magnesium can even result in VFib, known as ventricular fibrillation, both very deadly dysrhythmias. Now, the lungs are going buck wild from dyspnea, difficulty breathing, and rapid shallow respirations. The GI is going buck wild with massive diarrhea.
Ooh, nasty.
Neurologically is going buck wild. You'll have confusion, irritability, insomnia, and even seizures. Now, neuromuscularly, you'll have increased deep tendon reflexes known as hyperflexion called clonus, big NCLEX tip right there, as well as muscle twitching and numbness, also called paresthesia. So now that we know what's wrong, what are we going to do about it as nurses? So here's some nursing interventions. And it's honestly really a simple fix. We're just going to add magnesium. So use our simple acronym SIM for our nursing interventions. S is for safety with swallowing because these patients are usually at risk for aspiration, or basically choking. I is for IV mag sulfate to replace that magnesium. But caution, give slowly because it could slow down the heart too much. So guys, watch out for hypermagnesium here. M is for monitoring respiratory status, and those hyper reflexes known as clonus are hyperflexion, which is a severe hypomagnesium sign. And lastly, our diet high in mag. We use the acronym CAMP on bananas.
The camp's gone bananas! B-A-N-A-N-A-S!
So the acronym CAMP on bananas, C stands for chocolate and cauliflower vegetables, A for avocado, M for milk, P for pork and peas as well as peanut butter, O is for oranges, N for nuts, and B is for bananas, so go bananas. All right guys, that wraps it up for hypomagnesemia. All right guys, that wraps up our lesson here. We'll see you in the next video.